Welcome to our last part of the Asian Stroke Symposium today. And this is the third part of it. And I'm Diana Lau. I am the host of this last part of the Stroke Symposium. And I'm the director of the Asian Health Institute at UCSF. And we work with the Department of Neurology as well as Chinese Hospital to put this Asian Stroke Symposium on for you. So welcome. 歡迎各位參加我哋今日嘅講座。呢個咧係我哋嘅網上亞裔中風嘅研討會嘅第三部分，亦都係最後一個部分。咁我咧就係劉淑儀，係呢個加州大學舊金山分校亞裔健康研究院嘅主任。呢個咧就係我哋今日嘅行程啊，就有1、2、3、4有4個講者同我哋講呢個中風嘅復原嘅，咁然後咧就跟住咧就有啲問答嘅部分。So this is our agenda for today. We have 4 parts and 4 speakers talking about the recovery and the Tele Stroke Program that we have with Chinese Hospital, and then we have a Q&A session in the end. Dr. Kim is our director of the UCSF Comprehensive Stroke Center, and we are the only comprehensive stroke center in the whole city of San Francisco, right, Dr. Kim?
Yeah, that's right.
Okay, and he did a lot of hard work to achieve this comprehensive stroke center status. So congratulations, Dr. Kim.
So thank you, Diana. I just wanted to say that it is such a wonderful opportunity for us to have this outreach to the community. And I'm so pleased that we have such a great panel of speakers this afternoon. As Diana mentioned, the previous sessions are available or will be available through a separate link. But today we're focused on recovery, on recovery resources, on complementary medical methods, and also our tele-neurology program, which links UCSF and the Chinese Hospital together.
咁咧，呢個咧就係我哋嘅金醫生啦。金醫生咧就係加州大學舊金山分校嘅綜合腦中風中心嘅主任嚟嘅。咁咧，呢個係一個好特殊嘅榮譽嚟嘅，因為係要做好多功夫先得到咁嘅做一個綜合嘅腦中風中心嘅。咁咧，金醫生咧就話我哋咧就係同三藩市嘅東華醫院咧係有一個合作嘅計劃，係照顧呢啲腦中風嘅病人嘅。咁就呢個亦都係一個好特殊嘅計劃。咁佢亦都好高興我哋可以做到呢個腦中風嘅講座。OK， 咁今次咧就係第三部分啦。
Our first speaker will be Cathra Halabi, who is the founding director of the UCSF Neurorecovery Clinic. And I'm really looking forward to her talk today because we've been, again, focused on prevention and treatment of stroke. This is about recovery from stroke.
咁我哋而家跟住嘅講者咧就係 Dr. Halabi， 佢咧就係我哋呢個中風後康復同埋預後嘅中心嘅主任嚟嘅。
Thank you, Dr. Kim, for the introduction, and also thank you to the organizers of this. I agree, it's a wonderful opportunity. We do have a lot to cover today. I'm hoping to give you a glimpse into the future for what prognosis and recovery might look like in our hospitals for a patient who's had a stroke. This is our outline for today. So we'll start with a high-level introduction and describe a few current tools that we use to offer a prognosis to patients in the hospital. And I should say that, I think this has been covered in previous sessions, but stroke causes irreversible injury to the brain. And prognosis implies that we're able to give patients and families information about how they will recover over time after their stroke. And so I'll describe a few emerging approaches for prognosis, and then we'll shift into some more novel techniques that we'll be using to offer more personalized information to patients and families. And then we'll illustrate these concepts with a couple of examples.
咁咧 ，Dr. Halabi 咧就係佢主修咧就喺呢個腦中風之後復原嗰個預後啊，即係估計將來嘅復原嘅過程嘅重要嘅係一個非常之重要嘅部分咯。咁佢呢個咧就係一個好特殊嘅，即係喺腦中風方面咧，仲係再 可以講係再分化出嚟嘅一個專科嚟嘅。咁咧佢咧就係會講一堆係一啲當前嘅預後嘅新興嘅工具啊，同埋咧係可以用呢啲工具咧係做一個例子嚟到解釋俾大家聽嘅。咁我哋拭目以待。
So just to give this theme a bit of depth, there's a very high global burden of disability from stroke. There are over 100 million survivors of stroke around the world, and in the United States alone, almost 1 million people have a stroke each year. But we have some incredible advances in treatments in the emergency setting, which you'll hear about this afternoon. But this does mean that we have many more survivors of stroke with persisting impairments.
咁咧，當然大家都知道啦，中風係一個好多人有嘅病啦。咁咧就係全球嚟講咧，係有1億同100萬嘅人係中風嘅。咁咧係每一年咧都有成100萬嘅人中風嘅。咁咧就依啲即係依啲人咧就係會因為而家嘅醫學技術昌明啦，咁咧佢哋咧係以前就中風咧就會死嘅，但係而家中風咧就可以唔死嘅，咁咧就變咗係好多有殘障嘅幸存者啦。咁而家所以咧，我哋今日就係講呢個復原嘅過程，係一個非常之重要嘅環節嚟嘅。
Long-term impairment is actually present in most stroke survivors, whether this is weakness on one side of the body, trouble walking, language difficulty, memory, and so on. But unfortunately, there have been decades of treatment trials that have produced mixed results, and this is in part due to the variation in study participants. And so there's been a one-size-fits-all approach to studying patients and treatment for stroke recovery in a wide variety of circumstances, including the stroke characteristics like size, location, timing from stroke, and so on.
咁咧，大部分嘅中風嘅幸存者咧，其實都有一啲嘅殘疾喺佢哋嘅生命之中嘅。咁咧就呢個殘疾嘅過程咧有好有壞啦。咁咧就我哋知道咧，就因為每個病人嘅特徵又唔同啊，佢嘅健康背景又唔同啊，同埋咧佢就算中風中邊種風咧。中風幾耐咧，個嚴重程度咧，咁又亦都唔同嘅，所以咧係唔可以一概而論話，呢個復後嘅即係呢個復原嘅過程係會點咯？所以係會用一啲新嘅方法喺度嚟去做呢個估計，佢嘅復原係每一個病人自己復原嘅程度係咩情形嘅。
So predicting how well someone can recover from stroke has enormous implications for how their rehabilitation and other related treatments can be customized, has enormous implications for the information we can provide patients and families for planning during the recovery phase. And in fact, to some degree, we can predict how well someone will recover from stroke with a variety of pretty consistently evidence-based features like age, stroke severity, stroke size, and location. But if we advance the slide by one, I hope you can appreciate that these are somewhat generic. They're certainly informative, but they're still somewhat generic and don't give us a picture of who the individual patient is and what their impairments are. And so can we improve upon the current standards of prognostication, despite how helpful they are? Absolutely. And it turns out that personalized tests that can measure more details about an individual's injury and function in day-to-day life can actually be used to predict recovery and give us better ways to offer a prognosis in the hospital.
咁正話都講過啦，因為每個病人嘅情況唔同啊，個身體嘅情況唔同，個年齡又唔同，中風嘅嚴重性又唔同，中風喺邊度嘅位置大小亦都唔同啦。咁所以咧，我哋係冇一個肯定嘅説法咯，話即係呢個中風嘅病人嘅情況會點樣啊？咁咧，所以咧，我哋咧就係要用一個預測嘅方法咧。呢個預測嘅方法咧就包含正話講嘅所有嘅嘢加埋落去咧，咁咧嚟到做一個復原嘅療程。
Great. So I might break this slide down for the interpretation. So So how do these sort of personalized tools work? Well, we're going to focus on hand and arm recovery for our illustrative examples today. And so shifting to some of these tests that go deeper than age or stroke severity or other elements that we just described, I'm going to show you some examples of how, let's say, weakness after stroke in the hand or arm can be measured, ranging from tools that can gauge brain activity all the way to arm biomechanics.
咁咧就係呢啲咧，而家咧就係佢講緊係用咩嘅工具去估計呢個復原嘅過程咧？咁咧就係佢係會用一啲測驗嘅，就係用一啲唔會傷身嘅測驗啦，就係去查一查個腦嗰啲電波啊，咁咧就睇下個腦嘅電波咧，睇下佢嗰個創傷。測量下佢嘅程度係點樣樣嘅。
As an examiner, and sometimes the results of the test can vary slightly from one examiner to the next.
身邊嗰度做啦，咁咧就但係咧，因為呢啲儀器咧嘅使用咧，係佢由邊個人去使用咧，就得到嘅結果咧，都係可能有少少嘅差別嘅。
If we want more precise information about what the brain is doing after stroke and how the brain activity relates to actual biomechanical movements of the arm, we do have the ability to measure these features at the patient bedside after stroke. So the top figure on the left-hand side is an example of a cap of sensors that non-invasively detect electrical activity of the brain. We can focus on the sensors that overlie the areas of the brain in charge of hand and arm motion, and we can identify patterns that are optimal for recovery or patterns that are suboptimal for recovery.
咁呢個咧其實係一個估計個病人嗰隻手啊嘅，佢中咗風之後咧隻手咧就係弱咗嘅，咁咧就係用呢個方法估計佢復原嘅情，咁咧就係同個病人咧就係做嗰個腦電波啦，喺上面嗰度你睇到有個人揸住嗰個嘢喺個頭上邊嗰度，咁嚟到測量嗰個腦電波嘅，咁然後咧就係用嗰個腦電波睇出嚟嘅嗰個結果啊，睇到係呢個隻手嘅復原將來係會係可以到咩地步。
The next figure is another really intriguing set of tools using transcranial magnetic stimulation. So these are some of my colleagues who are practicing together. But essentially, this is a non-invasive way of interrogating the activity of the brain and how it relates to hand movement. So I have a colleague that's placing the machine's tool over the area of the brain that's in charge of hand and arm movement. And when there's a signal discharged through that series of wires that's encased in a plastic sheath, that creates a magnetic field that can actually transfer into the brain through the skull, generate electrical activity in the brain, and trigger movement in the hand or arm on the opposite side of the body.
呢啲都係好新潮嘅測量工具咯。呢個係一個用磁場嚟到測量嗰個腦。佢咧就將個磁場咧，就將佢用呢啲嘅磁石，你見到黑色嗰啲咧，就係磁石咧就製造咗個磁場出嚟咧，就擺喺個人控制嗰個，即係我哋嘅腦部嗰度咧係有一啲部分咧係控制嘅手嘅喐動嘅。咁呢個病人嘅病情咧就係隻手有問題，即係中咗風之後隻手有問題。佢就將個磁場咧設計喺嗰個嘅腦嗰部分係控制手嘅喐動嗰部分，咁然後咧就用啲磁場嚟到刺激嗰個腦部，咁咧就睇到隻手有咩反應，咁嚟到估計佢將來係個復原程度又係可以幾大嘅。咁呢啲都係好細節嘅嘢啦，咁大家都唔需要知道好清楚嘅。但係咧就只係即係你唯一我想你知道嘅咧，就係我哋想你知道嘅咧，就係我哋係有一啲好相當新潮嘅工具嚟到幫助去估計呢個大腦嘅損傷同埋復原嘅過程。邊部分都唔緊要，個身體唔緊要，佢哋去嗰個腦嘅嗰部分個身體嚟到去刺激佢，咁就可以睇到嗰部分嘅手啊、腳啊、眼睛咩，即係有啲咩反應咁咯。
The figures on the bottom show my colleagues' video motion cameras. So essentially, these cameras have the ability to detect fine movements of the arm and hand, especially kind of micro movements around each joint. And so in combination, you can see how measuring brain activity in different ways, plus biomechanical movements of the arm, just offer much more granular detail about the patient's status after stroke.
This actually looks like our performance center at the Ortho Institute, where they have 360-degree camera set up to monitor, right?
Similar setup.
Yeah, similar setup. 咁你正話見到個磁場嗰個 setup 咧，就係喺左邊嗰幅圖啦。咁然後咧右邊呢幅圖咧，就係見到有個人企喺中間嗰度，咁啊有跟住1、2、3、4、5、6、7、8，有8個嗰個相機咧，就係圍住佢睇住佢。當佢係刺激嗰個腦嘅時候，睇下佢嘅手啊嘅動作啊點樣樣，係用一個360度嘅角度嚟到睇佢嘅，即係完全咁樣睇佢嘅。我哋呢啲咁嘅設計咧，其實喺嗰個我哋嗰個個人健康中心嗰度咧，都有呢個咁嘅設計嘅，係教人打波啊，點樣揈嗰個拍啊，可以揈得好啲嘅，咁就係用呢啲 camera 去影佢，然後咧就睇下佢係喺邊方面可以改進，咁咧就用一個同樣嘅理念咧，就喺呢個中風嘅病人嗰度嚟到設計，就係可以幫到佢復原嘅過程。
Essentially, the results of tests like this, which can be acquired at the patient bedside in the hospital, can then be input into a predictive algorithm that will then give us a range of how well the patient is going to recover at 3 months or 6 months or down the line. We're focusing on hand and arm movement for the purpose of this talk, but really prognosis should focus on each neurobehavioral domain independently. So there should be a similar approach for walking, for language, and so on, so that we really have very nuanced ability to provide the patient and family and the healthcare team with information about how to plan for recovery and rehabilitation.
咁咧，大家咧可能知道，以前咧，如果係病人中咗風之後，咁個家屬問個醫生話：咁佢嘅復原將來會點㗎？要幾耐啊？咁好多時啲醫生都講唔到啊，因為係冇呢啲咁嘅工具去幫到佢哋去做呢個估計啊嘛。咁而家有咗呢啲工具之後咧，咁呢啲工具咧其實咧都唔係淨係手啊腳啊可以嘅，我哋即係甚至佢嘅語言啊，或者睇嘢啊。任何嘅殘障都好啦，都可以我哋喺個腦嗰度咧，知道個腦邊部分係負責呢個行動，即係嗰個殘障嗰個部位啊。咁咧就可以用呢啲咁嘅方法咧嚟到估計每一個殘障嘅地方咧係點樣復原得會幾好同埋會幾快。
And these approaches are all under investigation at UCSF.
Okay, 咁而家咧我哋係 so we are one of the forerunners, right, in this.Yes,
I think, using these tools to study stroke in the early phase in the hospital is certainly novel and understudied, underutilized. And so we're excited to develop these prognostic tools and then deploy them more widely. And our focus is also making sure that we transition to tools that would be widely available to others who may be in more resource-limited settings. So if we're doing all the detailed work here, but we want to fine-tune things enough to then be able to hand off more user-friendly and easily deployable, cost-effective, safe, non-invasive tools to others.
咁而家呢個係我哋做呢樣嘢咧，就係仲喺個研究嘅階段之中啦。咁咧就係個結果咧就係相當理想下嘅。咁咧就呢個醫生咧就估計啦，就係將來如果將呢個設施啊完善咗之後咧，係可以比較做一個用一個容易啲嘅方法咧，與其他嘅醫院啊醫生啊分享，等佢哋都可以用到呢個方法。去同個病人做一個有效啲嘅估計。
Great. So I think in the interest of time, we've sort of talked about this concept. You can advance one more. I think there's an illustration here just showing how the different test results can be input into the algorithm that will provide a range of prognoses. And this is important because we may over or underestimate someone's ability to recover while they're still in the hospital, and for many reasons, including resource allocation or not overlooking an opportunity to really intensely help somebody with their rehabilitation. We think that having this tool at the bedside is really critical.
咁咧，我哋同佢做呢啲咁嘅測試咧，係個病人咧仲喺醫院嗰度嘅，即係佢中咗風啦，咁我哋幫佢啦，咁佢仲喺醫院嗰度嘅，咁我哋咧就做呢啲咁嘅測試嚟到幫佢。呢啲測試咧得到出嚟嘅結果咧係非常之重要咯，因為咧如果係個測試話佢復原得會幾好㗎，會有9成10成都得㗎咁我哋咪會積極啲，即係你去設計佢嘅復原個過程之中啊，咪會積極啲去同佢做啦，係咪？但係如果得到出嚟嘅結果只係得都係得2-3成嘅啫，都係唔喐得幾多咁你變咗就唔會放咁多資源落去，因為得到出嚟咧，你冇結果啊，咁所以咧就係喺呢個資源分配方面咧，呢個康復嘅估計啊係非常之重要嘅。咁而家呢張圖片咧就只係講我哋正話講過嗰啲嘢啫，就由冇結果到可以回復正常嘅最右邊嗰度啊，咁所以我哋就知道係用呢啲工具咧係可以揾到出嚟嘅。
Essentially, I wanted to say that historically we think of brain injury, including stroke, as of course the number one priority is preventing the injury to begin with, but then there's been intense focus on the emergency treatments, which you'll hear about very soon from Dr. Douglas. Of course, this is important to prevent a worsening of the injury during the emergency itself, to even reverse some of the early changes after injury. But I think we're moving into an era where the recovery and rehabilitation piece is going to receive as much emphasis as the prevention and actual emergency treatment component. And I would further argue that, the recovery and rehabilitation phase is pretty long-standing, and we, as providers or of the health, or a member of the healthcare team for the patient, should really be there to support the patient and family as their needs evolve over time.
咁咧喺中風個領域嚟講嘅呢個病情嚟講咧，我哋通常咧之前咧就係大部分嘅精力咧就係講喺點樣預防中風啊，同埋咧係點樣係可以個病人嚟到醫院去到急症室嘅時候點樣幫到佢啊，點樣盡量係幫到佢呢個中風嘅損傷減少啊咁。但係咧喺個康復嗰個過程之中咧，通常都係冇咩講，係好忽視嘅。我哋而家即係呢個醫生咧就係話俾你聽咧，其實個病人中咗風就係一剎那嘅時候，當我哋幫佢亦都係嗰幾日喺醫院嘅時候，但係佢以後嘅生命啊，漫長嘅生命，年年月月日日都係喺呢個康復嘅過程之中嘅，所以康復呢樣嘢咧係一個非常之重要嘅環節，係一直被忽視嘅。所以咧佢嘅估計咧就係呢個康復嘅過程同埋康復用嘅工具啊，點樣用咩方法幫病人康復好啲啊？呢個咧將會係一個好大嘅主題啦，喺個中風嘅治療之中。
And I say these things as a physician who practices both in the hospital and outside of the hospital. So I really believe in the importance of all elements of stroke care. And so you can see how having detailed information about the various impairments of a patient can help you titrate your treatment over time. But in the meantime, I think it's important to emphasize the recovery and rehabilitation augmentation tools we already have at our disposal as novel treatment trials are underway. So it's critical to have strict control of blood pressure, cholesterol management, diabetes management, tobacco cessation. These are all both stroke prevention strategies and also recovery augmentation tools. They're important for brain health in general. But I can't emphasize the importance of exercise and other lifestyle modifications as well. So if you wanted to advance just one more, there's more and more evidence linking various types of exercise to specific domains of improvement, neurobehavioral domains of improvement, whether this is cognitive improvement, memory improvement, mood improvement, and so on. And I think that in the years to come, we will see many recovery treatment trials designed using exercise as either an individual treatment modality or a modality paired with conventional therapies or some of the novel tools that are under investigation now, such as brain stimulation and other techniques.
喺呢個中風之後啊，咁喺佢復原過程之中咧，當然係我哋會 盡量係希望用第一啲新嘅方法去幫佢啦。新嘅方法之餘咧，就係一個中咗風嘅病人啊，佢第二次、第三次中風嘅機會咧，係比其他嘅人高嘅。所以我亦都係要喺呢方面咧，係做一啲預防嘅嘢，等佢唔好再中第二次或者中第三次風嘅。咁所以咧，喺呢個中風嘅預防之中咧，亦都係呢個喺康復過程嘅一部分嘅工作嚟嘅。咁啊，當然中風就係好多時就要控制個血壓啦，控制個膽固醇高啊、糖尿病啊。或者如果係仲食煙嘅朋友就一定要戒煙啦。既然中咗風仲唔戒煙，咁啊即係自己害自己啦，係嘛？咁然後咧，呢個飲食同埋運動咧，亦都係一個非常之大嘅環節啦。呢個運動咧就應該係呢個病人嘅生活一個非常之重要嘅部分，係要自己去 keep 住去做啦。
So of course, talk with your doctor before changing any of your diet or exercise routines. But again, I can't emphasize the importance of this enough.
咁我哋咧好多時咧都係積極咁樣係同病人講話，你改咩嘢都好，改藥又好，你自己突然間唔食一啲藥，或者係改變你嘅生活習慣啦，或者係飲食啊，諸如此類咧，請你同你嘅醫生傾下先，唔好自己去做，因為自己做咧，如果做錯咗咧，得到嘅後果咧係要自己承擔咯，咁可能嘅後果係唔好嘅，咁所以咧。同個醫生咧係應該做一個親密嘅戰友嘅關係啊嚇，有咩嘢同佢講，唔使怕醫生㗎，醫生應該係盡量會幫到你嘅。
And again, more and more evidence is going to continue to support these changes, in particular the exercise, likely in combination with other novel techniques for recovery.
咁咧正話講過嗰啲嘢咧係即係中風之後大家要做㗎啦，咁遲啲咧就會再同你講呢個社區嘅資源嘅，有另外一個講員同你哋講嘅。
Great. And just in closing, I wanted to tie everything together by reiterating the value of characterizing stroke in detail so that we truly understand the patient and the patient's needs and how their symptoms may evolve over time. This characterization feeds into more detailed prognosis, and this characterization helps with better treatment trial design so that we can determine which treatments to apply to specific patient population.
So anyway 咧，咁呢個即係一個總結嘅 slide 咧，就即係主要嚟講咧，就係正話講過嗰啲嘢啦，就係呢個康復同埋呢個復原嘅過程同埋呢個預防咧，其實係三位一體嘅。咁咧就喺將來嚟講咧，對呢個中風嘅病人咧，會係更加會被人關注。
Great. Thank you very much for letting me share with you some of the work that we're doing at UCSF that we can hopefully bring to the community soon.
咁多謝我哋，亦都多謝 Dr. Halabi 嚇。
Our next speaker is Vanja Douglas, a colleague of mine who directs the Tele Stroke and Teleneurology program at UCSF, to talk about the Tele Stroke program that we have between UCSF and Chinese Hospital.
Okay, great. Well, thank you so much for inviting me to speak to you all today. I really appreciate the opportunity, and I really appreciate the partnership that we've been able to make here with Chinese Hospital and UCSF.
咁咧，Dr. Douglas 咧就係好高興係我哋可以同東華醫院一齊做呢個計劃嘅。
Great. So I'm going to start with something that you already know and probably has been discussed already in the Stroke Symposium, but I think that it's important to go over why a teleneurology program matters for the community around Chinese Hospital.
咁咧，佢就係話我哋而家佢將會講嗰啲嘢咧，可能係即係如果大家有參加第一部分啦、第二部分咧，就已經聽過噶啦。但係佢而家想重提出嚟講咧，就係話用呢個咁嘅題目咧，就帶出點解我哋同東華醫院呢個合作計劃係咁重要。
We know that intravenous stroke treatment must be given within 4.5 hours of stroke onset, and mechanical thrombectomy must be done within 6 hours of stroke onset to be effective. There are a few patients who may still benefit from mechanical thrombectomy between 6 and 24 hours, but in large part, stroke treatments need to be given very, very quickly in order to reverse the stroke right after it starts.
主要嘅原因咧就係呢個時間性啊，我哋有一個黃金嘅時間，係呢個黃金嘅時間，如果過咗咧，我哋係即係好難去幫到呢個中咗風嘅病人嘅。咁咧呢個黃金嘅時間係咩咧？如果係用藥打入靜脈嘅咧，就係4個半鐘頭，即係由中風開始，一開始有症狀嘅時候開始，只係得4個半鐘頭。咁大家知道好多人都好猶豫噶嘛，對中風嗰啲症狀，佢成日喺度諗住話係唔係咧？可能唔係嘅，咁自己呃自己。咁所以呢個4個半個鐘頭咧係非常之快過去嘅。當你喺度諗緊、等緊、想緊好唔好打呢個911嘅時候咧，嗰4個半鐘頭已經喺你眼前走過啦。咁咧，而且咧係我哋如果用呢個機械呢個血栓切除手術，即係將嗰嚿血栓啊，嗰嚿血塊咧抽喺個腦部抽出嚟咧，呢個係一個手術嚟嘅。咁係上一次係Dr. Higadashi 講嘅啦。咁咧就係喺中風之後咧係要6個小時之內進行嘅。咁你4個半鐘頭到6個鐘頭，好快過啲時間 ，OK？ 咁你跟住要打完911，又要等救傷車嚟，救傷車嚟完又要等救傷車去到醫院嗰度，咁然後入到醫院啦，都有少少時間要去做一啲即係證實係佢係中風㗎。咁呢個時間咧，你係好快呢個黃金嘅時間咧就過咗嘅。咁有一啲少數嘅病人咧，就雖然係過咗6個鐘頭，就喺24個鐘頭之內咧，都可以做到呢個咁嘅拉咗嗰嚿血柱出嚟嘅，但係就唔係個個都得咯。
So just to recap what happens in a stroke, if this is our brain here, the little neuron represents the brain and then a blood vessel traveling to the brain.
佢而家咧就係講係話如果係有嚿血塊由嗰個靜脈嗰度去，即係由嗰啲血液嗰度去咗帶咗個腦部嗰度，係點樣治療？然後係呢個係用藥打入去靜脈嗰度嘅治療。
In a stroke, there's a blood clot that blocks an artery, and then there's no more blood flow to the part of the brain, and then that part of the brain, if it's lacking blood flow for long enough, will die.
咁如果當有嚿血塊塞住嗰個血管啊，咪好似心臟病發咁樣塞住個血管冇血到，咁嗰個部位嘅心臟或者係腦部咪會死亡咯。
This is where we can give this medicine called TPA intravenously within 4.5 hours of that blood clot forming, and it will dissolve the blood clot. The hope is that it dissolves the blood clot and restores blood flow.
咁咧，所以咧就係當係個病人中風係因為有個血塊嘅時候咧，咁咧如果係喺4個半鐘頭之內啊，佢係可以去到急症室，係可以用呢隻特別嘅藥，係一個將嗰個血塊散開嘅藥叫做 TPA 咧。咁嗰個病人咁個血塊溶咗啦，咁咪個中風咪化解咗咯。所以嗰個血塊冇咗啦，嗰啲血去咗啦，腦通過啦。
So the other treatment, just to illustrate it, is mechanical embolectomy. And this slide where the white arrow is, shows a blood clot in one of the brain's arteries. And then you can see there's no blood flow to the entire area past that blood clot, past that white arrow.
咁呢個咧就係用呢個磁性共振掃描呢個係呢個斷層嘅電腦掃描啦，影出嚟嘅相嚟嘅。咁咧就係打咗啲顯影劑落去，嗰啲顯影劑咧就跟住條血管，跟住啲血液咁樣行。所以你見到有黑色嗰啲地方咧，就係有血道嘅地方。呢個係個病人嘅腦嚇。咁咧，如果係冇突然間斷咗嘅地方，就係個箭嘴指住嗰位啦。就即係話嗰啲血咧，嗰度有嚿血塊擋住咗啲血，就去唔到下邊嗰一部位啦。
The interventional radiologists can advance a catheter to the blood clot and then withdraw the blood clot using something called a stent retriever, which is shown in the lower right. And then that restores blood flow to that part of the brain. And that needs to be done within 6 hours in most cases.
咁如果係用冇用稀血劑咧，咁係可以喺下邊嗰幅細嗰個相嗰度咧，你係睇到有個鐵絲網咁樣拉咗嗰嚿血塊係咪？咁我哋咧就會整咗條管入去，拉咗嚿血塊出嚟啦，就成嚿血塊拉走咗嘅。咁但係醫藥呢個咁嘅手術咧，就係要喺中咗風之後6個鐘頭之內即刻做嘅。 咁你見到左邊嗰幅圖咧，嗰啲血就繼續去啊，就冇停咗，突然間中間停咗咁啦。
So we know that the longer the brain is without blood, the more damage is done. And therefore, the earlier we can treat patients, the better outcomes they have.
咁呢個大家都應該知道㗎啦，時間就係大佬，每一分每一秒都有腦細胞死亡嘅，如果佢係冇血道嘅話，所以咧盡早去有呢啲咁嘅稀血藥或者有呢啲咁嘅方法手術方法拉咗嚿血發出嚟咧，個腦得到翻啲血液到嘅時候咧，就可以帶到最好嘅效果嘅。
So if you're experiencing a stroke, we want patients to be able to get to the nearest hospital where they can be treated with one of these treatments as quickly as possible.
咁所以咧，時間係咁重要啊！個病人去到醫院，中間要有交通噶嘛，所以係要去最近嗰間醫院嗰度治療嘅應該。
So, in order to have access to stroke treatments at a hospital, a stroke team needs to be available 24 hours a day, 7 days a week in the emergency department.
所以你去到醫院都要有醫生先得㗎。咁所以個醫院裏邊咧係要一個星期7日，每日24小時都有呢啲咁嘅腦科嘅專科醫生喺度嚟到照顧呢啲咁嘅中風病人嘅。
But at Chinese hospital, there are not enough full-time neurologists to staff the hospital 24/7.
咁但係東華醫院咧就因為係一間比較細嘅醫院咧，就係冇呢個腦科嘅醫生係即係每一分每一秒都喺度嚟等服務呢啲中風嘅病人咯。
So to solve that problem and allow Chinese hospital to treat stroke patients, the partnership with UCSF is to bring UCSF teleneurology to your emergency room and hospital with 20 availability 24 hours a day, 7 days a week, 365 days a year.
所以咧，東華醫院咧係非常之聰明啊！咁佢哋咧就同我哋嘅 UCSF 呢個腦科咧就做咗一個合作計劃。咁咧就等我哋嗰啲腦科醫生咧係隨時可以係佢哋如果一話俾我哋聽有個病人嚟咗嘅時候咧，我哋就可以同佢哋直接聯絡嚟到幫呢啲有中風嘅病人嚟到做決定要做啲咩嘢嘅，係即時服務嘅呢樣嘢係。
So this is a map of Northeast San Francisco showing where the nearest hospitals are to Chinatown. And I just show it to illustrate the point that if a patient has a stroke and they live in Chinatown, it is much faster to get to Chinese hospital than to get to St. Francis or CPMC via ambulance.
咁我哋睇到咧嗰啲紅色十字圈嗰度咧，你就睇到啲醫院啦。一個咧就係東華醫院啦，有個黑色箭嘴指住嗰個東華醫院啦。咁咧跟住咧就你見到第二個箭嘴嗰度咧就係可能係嗰個太平洋醫院啦。咁就有同埋聖 Francis 醫院啦。咁咧就係其實最近嗰間醫院啊，如果當個病人住喺唐人埠嘅時候，最近嘅醫院咧就係東華醫院。
So by having teleneurology, patients are able to get intravenous stroke treatment at Chinese hospital, and that means that they can get the treatment much more quickly.
咁所以咧，如果將個救傷車咧，當個救傷車咧係將個病人喺一個喺唐人埠住嘅病人或者東北嗰個地方嘅病人咧，係帶去東華醫院嘅時候咧，咁就會同我哋嘅醫生喺加州大學嘅醫生聯絡上。然後咧就可以即刻俾呢個稀血藥呢個病人，就將佢嗰個血塊嚟你溶解咗嘅。
Now, if a patient needs not only intravenous stroke treatment, but also mechanical embolectomy, or if they only need mechanical embolectomy, then they get transferred directly from Chinese hospital after being evaluated there to UCSF for the mechanical thrombectomy treatment.
咁但係當一個病人咧，佢如果係嗰個血塊可能太過大啊，係用呢個溶血嘅藥咧，係溶血劑咧，係唔可以將佢成嚿溶晒嘅時候咧，嗰個病人咧 喺我哋嘅醫生嘅鑑定之下咧，就會即刻用嗰個救傷車咧，就即係將佢車嚟呢個加州大學嘅醫院嗰度咧，就以為將個血塊做手術攞出嚟嘅。
So how does teleneurology work? It works by bringing the doctor to where the patient is instead of the patient going to where the doctor is.
咁呢個遠程嘅神經學係點樣做嘅咧？就係唔係個病人嚟我哋嗰度，係我哋嗰啲醫生去到個病人嗰度，係倒翻轉頭嘅。
So you would, a patient would come into the emergency room at Chinese Hospital and see the emergency room doctor there. I should say, well, it's okay. They would see the emergency room doctor there. And then if it looks like they're having a stroke, the emergency room would call the teleneurologist and bring in the teleneurology video consult into the patient's room.
咁咧，呢個咧就係用一個遠程嘅神經學，係用呢個 Zoom 呢個科技嚟到做嘅。咁咧就係點咧？當個病人由個救傷車或者自己去咗由家屬送咗去東華醫院嘅時候咧，希望唔係咁啦，希望係叫救傷車啦。送咗去東華醫院嘅時候咧，咁咧東華醫院急症室嘅醫生咧就會即刻去打電話俾加州大學嗰個腦科嗰個急線嘅。咁然後咧就會嗰個腦科醫生咧就會用急線咧就收到呢個 call 之後咧就即刻去聯絡上用呢個鏡頭啊，就睇到東華醫院個病人嘅情況，然後同嗰個東華醫院嗰啲醫生嚟到做一個合診嘅。
And then the teleneurologist appears on the screen and conducts a neurologic assessment, just as if they were in the room with the patient.
咁呢個腦科醫生咧係加州大學腦科醫生啦，其實呢個就係 Dr. Douglas 自己，咁咧佢咧就會睇到，因為有個鏡頭啊嘛，就會睇到個病人嘅情況，亦都會同醫生一齊東華醫院嘅急症室醫生一齊傾偈，咁然後決定係點樣做最好嘅。
Our partnership with Chinese Hospital is not just for stroke patients. We will see any patient with any neurological problem in both the emergency department and in the hospital.
Dr. Douglas 咧就話咧，我哋呢個計劃咧，雖然係初開始嘅時候咧係為中風病人而設，但係咧佢哋可以做嘅嘢咧，其實係唔止中風病人嘅，其他有腦科問題嘅病人咧，都可以，我哋都可以用呢個遠程嘅診斷嘅方法咧嚟到輔助東華醫院咧去照顧呢啲病人，即係譬如可能係抽筋啊，或者係有呢個帕金森啊呢啲，即係其他嘅腦科嘅症狀咧，都可以用呢個方法去做嘅。
A very important part of our evaluation is the neurological examination, but that can be done over video, and translators are always available. So we can communicate with patients in any language.
咁所以咧，雖然我哋嗰啲腦科醫生咧，大部分啲人都唔識講中文啦，但係咧，東華醫院嗰度啲人識啊嘛。咁而且咧，我哋即係亦都有啲傳譯嘅人員咯，所以呢個語言咧係冇障礙嘅。咁呢個檢查嘅過程之中咧，應該係進行得非常之順利嘅。
We also review patients' charts, can look at any radiology images that they get at Chinese Hospital, and then we write notes in the chart, just like any doctors at Chinese Hospital, and we communicate with your physicians there. So it really is just like we're part of the medical staff.
咁所以咧就即係好似雖然係只係用一個錄像嘅方法，但係就其實係好似個人已經去咗東華醫院啦，嗰個醫生嗰個神經病醫生，即係神經專家啦，咁咧就已經去咗個醫院嗰度，係企喺個醫生隔離一齊會診咁樣，係又可以睇到嗰啲圖像啦。如果佢做咗啲咩嘅影咗啲咩嘅圖像啊，咁係可以即刻睇到啦。個病人有咩症狀，又可以即刻知道啦，又可以同嗰啲醫生一齊會診啦。咁然後咧，又可以喺嗰個電腦嗰度咧，就可以打個病人嘅記錄啦，咁樣係通通都可以做到嘅。
So we are just absolutely thrilled about this partnership, and all of the I know I can speak for all of the neurologists on my team that we're incredibly proud to be helping provide this service to your community. And I want to thank everybody on the Chinese hospital team for your partnership and collaboration in making this happen.
咁啊，Dr. Douglas 咧就因為呢件事咧亦都非常之高興嘅，因為可以幫到我哋華人社區咧，亦都係佢嘅心願嚟嘅。咁佢咧就當然亦都要係好多即係東華醫院嘅領導層啦，因為係佢哋做嘅決策，我哋先至會有呢個咁嘅合作嘅機會。
And thank you to our team as well. Thank you, Diana.
咁Dr. Douglas 亦都多謝 UCSF 自己嘅團隊啦。
So our next speaker is Esther Chen, who will be talking with us about acupuncture for recovery after stroke. We're really pleased to have her present today.
Hello, 大家聽唔聽得好？聽唔聽得到？ I'm the licensed acupuncturist and herbalist working at Chinese Hospital East-West Health Services. And I'd like to talk to you about how to use acupuncture to enhance recovery after a stroke. 咁我咧係陳嘉冕中醫針灸師嘅，我係東華醫院中西醫學門診部。咁我今日咧係想同大家講點樣使用針灸療法嚟促進中風後嘅康復嘅。咁何謂針灸咧？呢個咧就要講少少中醫嘅喎。So what is acupuncture? Because acupuncture is part of the traditional Chinese medicine. So acupuncture is based on the traditional Chinese medicine healing through the insertion of needles on acupoints to restore balance to the energy levels of the body. And there are more than 350 acupoints in the body. Increasing the flow of energy through these points help with bringing the balance to the body. And the principle behind acupuncture is stimulation of the nervous system and the vascular system. 咁針灸咧，其實係可以即係意思喺人體身上有超過350個穴位嘅。咁我哋將啲針喺呢啲穴位嗰度咧，係令到身體嘅血氣運行好啲嘅。咁有陣時中醫相信話氣機唔平衡咧，個人就容易病嘅。咁我哋咧針灸係可以針灸神經系統啦，同埋血管系統嘅。And acupuncture can be successfully incorporated with modern Western medicine. So in the Bay Area, many hospitals, including UCSF and Chinese Hospital, we have our acupuncture departments as the integrative approach in patient care. And in 2003, the World Health Organization cited a number of conditions that respond to acupuncture. And a number of studies demonstrated the efficacy of using acupuncture for post-stroke recovery. 咁當然喺呢個灣區啦，東華醫院同埋 UCSF 三藩市醫院咧，亦都係有自己啲針灸醫生可以幫助唔同嘅症狀嘅。咁當然我哋希望呢次嘅講座咧係針對中風後嘅康復。咁講一講針灸咧，其實係中醫一部分啫。咁中醫咧已經係超過2000年嘅歷史㗎啦。咁中醫除咗有針灸啦，亦都有指壓嘅。咁甚至係有氣功啦，或者係我哋有啲食療嘅。咁我哋就話 ，Can TCM really help to speed up the recovery of stroke rehabilitation？ 咁我哋咧就話，中醫係咪真係可以幫助到中風之後嘅康復、加速嘅康復咧？咁其實有好多臨床嘅實驗同埋研究咧，就證實咗針灸、拔罐同埋指壓係可以嘅喎。Many clinical trials and studies demonstrated that acupuncture, cupping, and acupressure actually does enhance the recovery. For example, the motor and sensory functions return at least 30% after 4 weeks active treatment and 40 to 50% after 8 weeks active treatments. But of course, various factors could be slowing down the recovery rate, such as the types of stroke, your age, hypertension, high cholesterol, and diabetes. 咁當然，我哋喺運動功能同埋感官功能咧，如果喺4周嘅積極治療之後，係可以回復，希望至少有30%以上嘅。咁如果喺8周積極嘅治療之後咧，係可以睇到4到5成嘅恢復。咁當然有其他嘅原因係會引起康復嘅速度啦，比如話病人嘅年紀啦，佢係咪有三高嘅症狀啦，同埋佢中風嘅原因啦，同埋地方都係可以導致康復嘅速度嘅。咁比如話你 嚟到我哋嘅診所想睇中醫針灸嘅話，我哋會有初診咧，就會要你填好多啲表格啦，咁進行會診同埋中醫嘅我哋叫做診斷嘅，咁同埋有治療嘅，咁呢啲咧我哋點解 ？So acupuncture and acupuncture specialists started with an in-depth assessment of the patient's energy level, and we need to understand about sleep patterns, diet, mood, and any other imbalance that may upset the flow of the energy of the person. So answers to your questions and also a review of patient's medical history helps the specialist to draw up a profile of the patient. For us, it's because it's a couple thousand years ago, first of all, we will examine, which is observations of your facial complexion. We see your body type. We will examine your tongue. It's called tongue reading. And also, before we wear the mask, we are able to smell the body odor and also whatever sense that the patient is emitting. And for the ask, we ask about the main concern, also the lifestyle, your diet, your digestion, your sleep pattern, and exercise routine. For post-taking, we determine which TCM system is deficient, SS, stasis, etc. 所以咧，中醫嚟講，針灸師或者係我哋嘅推拿師，我哋首先係要你填咗一啲表格嘅，咁我哋可以更加清楚咁了解你嘅人嘅身體，比如話你食飯好唔好啊，胃口好唔好啊，瞓覺好唔好啊，同埋我哋要打脈啊，睇你象啊，睇你嘅面色而決定你呢個人係屬於中醫邊一個辨證咯。咁咧，我哋喺針灸嗰陣時嘅情況，就可以係同你建議一啲飲食啦、運動啦，同埋生活方式嘅建議嘅。咁呢個係一個相啦，比如話我哋係會睇一睇你嘅，係咪？咁中醫同埋西醫咧，當然係有少少唔同噶啦。其實唔係好少少，其實有啲嘢係唔同嘅。即係我淨係舉個例 ，OK？ 咁咧就話我哋可能中醫有啲中醫醫生打咗你個脈就話，你好似肝氣鬱結喎，你有啲血瘀喎，咁你會覺得咁我係咪要睇下我家庭醫生或者我嘅醫生問下我係咪個肝有問題咧？但係呢個唔一定嘅喎，點解咧？因為咧中醫嘅肝咧係令到我哋係知道個氣機喺佢全身嘅順暢流動嘅。咁亦都係可以係儲存嘅血液啦。咁跟住咧，我哋係同嗰個肝咧，中醫嘅肝咧係同個肌腱、指甲同埋眼睛係有相連嘅。比如話有陣時你有黃疸，我哋睇一睇你嘅眼係黃黃地嘅，咁我哋就知道你可能有啲肝炎喎，或者係膽汁堵塞咗喎。So for TCM post-taking, in order to prescribe the correct points, for a points prescription, we need to look at the tongue, we need to check the pulse, because that's our way to determine what is the TCM diagnosis. For example, the Chinese determination of liver qi stagnation, maybe, let's see, how to say, because Chinese, the liver function is to ensure the energy and blood flow smoothly throughout the body. And then it regulates the bile secretion, it stores the blood, and it's connected with the tendons, nails, and eyes. So we may have a patient come in with the same Western medicine diagnosis, a stroke. However, they can have different TCM diagnosis, such as liver qi stagnation. Then we use different points for liver qi stagnation. And then if they are prescribed as diagnosed as spleen and kidney qi deficiency, then we will use different set of points to needle the patients to help tonify their spleen qi and kidney qi deficiency. So therefore, we have to work in conjunction and collaboratively. Additional TCM procedures, including cupping. So I'm pretty sure a lot of people have seen the bruise mark from the cupping, because the suction is created by burn off the oxygen inside the cup or using a pump to pump out the air on plastic cups. And the bruise from the cupping is caused by chronic inflammation, because we believe in local decreased blood flow cause the blood vessels lose the elasticity. So suction causes capillary rupture, and thus it causes the bruise. And the natural approach behind the cupping is to promote energy flow, because the body thinks that it's injured from the bruise. and increase local blood flow with oxygenated blood to repair the damaged tissue。咁我哋中醫咧認為話拔罐咧或者係刮痧啦，呢度如果你係有瘀咧，即係身上好似好多毒嘅。咁點解會有呢啲毒咧？就因為你慢性炎症，令到你啲血管咧佢嗰個彈性咧就冇咁好嘅。所以當我哋有呢一個我哋呢個負壓一壓嘅時候，一抽嘅時候，佢呢個微細血管咧就有啲破裂啦。咁破裂咗咪瘀咗咯？咁你嘅身體咧就諗住話：哎呀，我瘀咗啦，咁我要嚟修復佢嘅時候，我就係要帶一啲有氧嘅好嘅血嚟修復呢啲已經脆裂咗嘅血管，咁樣從而咧係令到佢局部嗰度嘅氣血咧係運行好啲嘅。OK， 咁跟住 the next is acupressure. So acupressure is another form of treatment if patient is afraid of needles. So we have a masseuse working at 2 locations, and acupuncture uses manual pressure while acupuncture uses needles and insert it under the skin. So to connect with the pressure points, it is believed that acupuncture gives better results because it has a deeper penetration into the blocked meridians. 咁有啲病人咧，佢哋係好怕痛嘅，因為諗住話針灸係用針喎。咁我哋個指壓師咧，我哋有一個指壓師，佢咧就係可以按照經絡有啲穴位同你進行指壓或者係推拿嘅。咁我哋相信針灸咧個效果可能會好啲，係因為咧針灸係可以深少少啦，同埋我哋係可以用唔同嘅方式。比如話我哋係用補法或者瀉法咁樣嚟令到身體嘅嗰啲我叫咩身體嘅一啲機能咧係有唔同嘅反應嘅喎。咁當然如果你係想食中藥嘅話咧，你就亦都可以醫生亦都係因為你嘅脈象理象而嚟俾一啲草藥嘅諮詢啦。咁因為中藥始終係喺中國日本韓國都係好接受得比較點講比較接納到嘅但係美國呢邊就仲未咁接納得。So and then the following are the photos of performing heat lamp and also cupping. So this is the one with glass. So I just burn off the oxygen inside the air, which create a suction. We also have sets of plastic cups, which just use a pump to pump up the air. 咁呢度你可以睇得到我哋有熱療啦。咁同埋呢個我係做緊呢個針灸唔係即係針灸完咗啦，咁個拔罐嘅 OK 呢個係電針 OK so then this is a photo with acupuncture needles placed on the body and then electroacupuncture it's connecting the electric current to it's for example if you have flaccid paralysis loose muscle tone. And for acute symptoms, sometimes if with swelling, we can use electroacupuncture to reduce the swelling as well. So how many acupuncture visits do I need to see improvement? Okay, the ideal numbers, it really determined by the severity of the cases. So it's recommended for the first 4 weeks after you discharge from the hospital, it's 3 to 5 times. Okay, and the severe case, we have internal capsule stroke or hemorrhage stroke, which affected a larger area in the brain, is considered severe. 咁我哋理想嘅次數係幾時咧？當然係喺你情況穩定之後，出咗院之後，咁我哋先至針灸嘅。咁最好咧係都係黃金時啦，即係你出咗院之後，盡量係4週每週係3到5次啦。咁咧有陣時我哋係按照嗰個內朗出血，即係內朗出血或者係內朗出血嘅範圍比較大嘅時候，神經損害症狀比較嚴重呢啲咧，就係屬於重症啲嘅。我哋話點樣中等嘅病例咧？每次就係每週係1到2次嘅。有陣時我哋話可能 moderate 嘅咧就係少啲血栓啦 blood clot。咁跟住如果係已經用咗藥嘅，或者係佢已經做手術將嗰嚿血栓攞咗出嚟嘅，但係我哋都唔知會唔會仲有啲好少嘅已經存留喺身體入邊。咁另外最輕度啲嘅咧，就係可能我哋叫做 ischemic minor stroke 啦。咁呢個就稍微輕微啲嘅。咁呢個咧就希望係可以每週1次，持續8週嘅。So stroke caused by blood clot or semi-blood clot is considered moderate as long as the area is not affected greatly. And then for ischemic or minor stroke, it's considered mild. So although the brain damage cannot be reversed, brain cells that have died are unable to repair themselves or regenerate. However, through the brain's ability to utilize neuroplasticity, function affected by a stroke may be recovered, but then the neuroplasticity is the brain's ability to rewire its neural circuitry, which allows functions affected by stroke to be reorganized and improved. And active circuit training via acupuncture and other therapies help to enhance the recovery. 所以咧，我哋都知道，當神經細胞壞死之後咧，佢哋係唔可以再重新或者係修復嘅。但係咧，神經嘅可塑性係會令到附近仲生存緊嘅神經細胞係可以重組連接起嚟嘅。希望積極嘅針灸同埋其他嘅輔助治療都可以係促進中風後嘅康復，但係呢個亦都係一個比較漫長啲嘅經歷時間，所以大家亦都係要有啲耐性咯。所以我先講一講東華醫院先。咁如果我哋東華醫院咧係有3個門診部嘅，咁亦都有一個按摩師喺2個地點做工嘅。So at East West Health Services of Chinese Hospital, we have 3 locations with different acupuncturists, and also we have a massage therapist working at 2 locations. So the different stages of paralysis also utilize different approach of acupuncture points and dietary recommendations and exercise recommendations. So during the flaccid paralysis stage, that's mostly occur a few days to 2 weeks from the stroke, which is considered Brunstrom stage 1. And the treatment principle is muscle strengthening exercise. We want to prevent spasticity from increasing, and we want to prevent joint deformity, prevent secondary stroke. During the spastic paralysis, it occurs usually 3 weeks to 3 months from the stroke, which is Brunstrom stage 2 to 4. And the treatment principle, it wants to prevent adhesion in the muscle. And then during the last stage is complex combinations and other symptoms associated with stroke at 3 to 6 months are shoulder semi-dislocations, muscle atrophy, muscle spasm. And our treatment principle will be active movement, resistance trainings, daily walks, daily strength training, emotional support, and also family support. 所以咧，我哋喺癱瘓嘅唔同階段咧，有軟癱啦。咁軟癱通常都係中風之後幾日到2個星期之間嘅。咁咧，我哋係希望可以令到我哋治療嘅方式咧，方針就係話要令到你有返力啦。咁希望係唔好再進到硬即係痙攣期嗰度嘅。咁亦都係可以希望係可以預防你嘅關節唔會變形。同埋咧，再預防第2次再中風嘅。咁第2個階段咧係叫做痙攣期。咁呢個痙攣期咧，通常都係3週到3個月喎。我哋咧個治療方針就係希望佢唔好肌肉有黏連嘅。咁之後有啲常見嘅合併症咧，就係比如話有個膊頭咧係我哋叫做一半甩咗出嚟，即係 semi-dislocation。咁同埋肌肉萎縮啦，咁同埋肌肉痙攣啦，咁呢啲我哋亦都係希望可以令到你更加有力，即係除咗你嘅心理、生理健康之外，即係家庭嘅嗰啲支持都係好重要嘅。咁會問到中醫有啲咩副作用咧？咁針灸之後，咁梗係有少少瘀痕噶啦。咁或者係你針完之後個人太舒服啦，咁有啲眼瞓喎。Okay, so for the side effects from traditional Chinese medicine will be bruising from the needle and also sleepiness, because we do try to avoid the capillary or blood vessels when we place the needles, but some acupoints are located next to or on the blood vessels. So bruising on certain points are a common side effect. And also acupuncture triggers endorphin release. The endorphin is a natural chemical that the body releases to relieve pain and lower the stress. So when one is relaxed, taking a short nap is preferred. Thank you. So 好多謝大家俾我呢個機會，即係同大家介紹中醫同埋針灸嘅。咁如果你哋有啲咩回答環節，可以留到最尾一部分嘅。And thank you very much for this opportunity.
多謝陳醫師。
Thank you so much for that presentation. The last presentation we have this afternoon is from Lindsay Carey, who will go over the patient and caregiver support and resources. Lindsay is our stroke navigator and interim stroke coordinator at UCSF.
咁我哋跟住嘅講者咧係Lindsay Carey，佢係我哋嘅病人同埋護理者嘅中風嘅聯絡人嚟嘅。
Thank you so much. I'm excited to be back. So I'm going to spend the next 10-15 minutes or so going over patient and caregiver support resources here within the community as well as some national organizations.
咁啊 Lindsay 就會同大家講呢個康復嘅資料嘅。
So Dr. Halabi built this really beautiful neurorecovery resource guide. It is for our neurorecovery clinic, and it was created as a guide for our patients, families, and our caregivers. And it's a really great website that features services and programs within the Bay Area that support patients with neurological injuries or concerns.
呢個資源嘅指南咧係Dr. Halabi 幫手製造出嚟嘅。咁咧而家其實喺嗰個 chat box 嗰度咧，多謝 Raymond 係已經係將嗰個 link 擺咗上去啦。如果你哋想得到呢個康復嘅資源指南咧，係可以將嗰個 link copy 咗出嚟，咁然後咧就睇到噶啦。咁咧佢亦都係將如果係各位係冇聽第一部同第二部嘅咧，係佢將嗰個 link 咧都擺咗上去嘅，你哋都可以將佢抄出嚟嘅。
We've also attached a QR code on the website as well as the handout that was, I believe it was sent out. And that is an interactive. So when you hover over that with your camera, it actually brings you to the Neurorecovery Resource Guide website. And so there is a stroke-specific resources, not just the broad Neurorecovery Resource Guide offers stroke-specific resources. And so there's a lot of different resources within our community listed there that provide direct links to their websites.
咁Lindsay 咧就講話，即係我哋其實個社會嘅對中風嘅患者嘅資源咧都幾多下嘅，但係咧就中文嘅就唔係咁多咯。咁咧就各位可以喺呢個 QR code 嗰度係影咗佢，咁就可以得到呢啲資源，或者係將你隻老鼠擺喺嗰個資源嗰個字嗰度咧，咁佢哋亦都係可以同你去到嗰個網站嘅。
If you're a patient at UCSF, there are some resources that we provide as you begin to transition either to home or to rehab. And so we work really closely with case management and social workers to be able to provide the support for patients and their families in this acute transition from hospital to either rehab or home. We also do condition-specific support groups, and those are for patients and families. And then we also do unique programs such as the Art for Recovery, Healing Through Dance, or the resource that Dr. Halabi mentioned, the UCSF PhysFit Health and Wellness Center.
咁就呢啲即係加州大學嘅中風部門嗰個資源啦。咁咧就係有呢個個案嘅管理嘅護士啊，或者係嗰啲社會嘅工作者啊，亦都有一啲支援小組咧係俾某一啲嘅病人嘅。咁然後咧就亦都有一啲好突出嘅計劃啊，就係譬如幫佢哋用畫畫嘅方法嚟到或者係幫佢哋去用一啲舞蹈嘅方法嚟到治療佢哋，即係等幫佢哋痊癒快啲嘅。
And then we also work really we work really closely with the American Heart Association and the American Stroke Association. And so this is a really great organization, as well as their website is very in-depth for helping patients and families navigate life after a stroke.
咁我哋都係同呢個美國嘅心臟協會同埋美國嘅中風協會咧，係有緊密嘅聯繫，係因為呢兩個協會咧都有好多另外一啲資源咧，係可以幫助啲患者同中風嘅患者嚟到復原嘅。
This particular website has resources on how to manage your stroke, different tips for daily living. If your home requires modification, the American Stroke Association also offers the Stroke Connection e-news, and it's a monthly publication that does come out via email and I believe mail that includes news and resources and stories for stroke survivors and their caregivers. So a really great community resource.
咁大家係可以用你個手機去將呢個鏡頭影咗佢嘅，咁咧影咗佢之後咧，你就有呢個咁嘅連接啊。咁就可以打上去啦，就可以得到多啲資料咯。因為呢個網址裏邊咧有好多資源咧，就教嗰啲病人點樣管理好中風後嘅生活啊。有啲咩小貼士啊，或者屋企裏邊要做啲咩嘅改建啊，係方便自己日常嘅生活多啲啊。同埋甚至有啲人係可以翻工嘅，之後可以翻工嘅，點樣先至可以翻工咧？咁咧就每個月咧都有一份即係中風嘅信息係可以係會登上去嘅。
Another great resource within the area is called the Bay Area Caregiver Resource Center. And there are 11 different centers throughout the state of California. And this organization offers free or low-cost services to the San Francisco Bay Area. And the eligibility to participate with this organization is that families must be caring for those with an adult onset brain impairment, and then family caregivers of adults age 60 and older. And they serve the counties of Alameda, Contra Costa, Marin, San Francisco, San Mateo, and Santa Clara. So they have a very large network that they provide services to.
咁咧，呢個係灣區護理人員嘅資源中心啦，佢有喺加州嘅不同地方咧分佈咗11個咁嘅資源中心嘅。咁咧，呢個資源中心咧係非常之有用咯，因為咧佢除咗係俾資訊你之外咧，佢係可以有服務嘅，係有人啊係可以嚟到免費或者用一啲好廉價嘅方法嚟到收費上門服務嘅。咁所以咧如果有可以符合到一啲條件嘅咧，即係譬如60歲以上啊，或者一啲收入嘅條件啊，或者係即係個症狀係有腦損傷啊，諸如此類啦嚇。咁咧，佢哋服務嘅地方咧係有不同嘅灣區嘅幾個大嘅縣咯，就好似 Alameda、三藩市啊、Marine 啊、Contra Costa、San Mateo、Santa Clara 呢啲咁嘅大嘅縣咧，通通都有佢哋嘅服務嘅地方嘅。咁咧，呢個咧又係你可以影嗰張相，咁咧就可以得到呢個網址同埋個電話可以打上去嘅。
Organization is the TAF. It's the Aneurysm and AVM Foundation. And so this is for patients that have experienced or been diagnosed with an aneurysm or an AVM or have had an aneurysm rupture. This organization provides support and resources to the community, and they promote education and awareness, as well as provide encouragement and funding for research. They do have a support group. Given COVID, that might be it might be a little bit different, but on their website, it says the first Thursday of the month. It's a virtual Zoom, and Dina Chan is their representative to get in touch with. This is us on the left-hand side. We participated in the TAF walk. It was their walk fundraiser for the year. And so UCSF, as well as Stanford and some other community organizations, participate in their walk.
咁呢個咧又係另外一個基金會嚟嘅，呢個基金會咧就專為嗰個即係有腦出血過嗰啲病人啊。咁腦出血咧通常係因為個腦裏邊嗰啲血管咧有個腫瘤嘅，有個動脈瘤嘅。咁咧佢咧就爆咗血管。咁呢啲咁嘅人士咧就有一個特別嘅嘅機構啊，係可以支援佢哋嘅。咁咧就左邊嗰幅相咧就係佢哋籌款嗰啲相啦，就有我哋其中一啲員工咧，咁就呢個支援小組咧係喺 每一個月都有一個聚會嘅，但係我相信係用英文講咯。咁如果大家想參加呢個聚會嘅咧，就可以去寫俾呢個 Dina Chang 嚇。
And then we also have the Chinese Community Health Resource Center. They provide resources in simplified Chinese and traditional Chinese, and that's offered at the Chinese Hospital.
咁咧東華醫院咧亦都有呢啲中咗風病人嘅資料嘅，係由呢個同呢個華人社區資源健康資源中心一齊做嘅。咁咧就呢個資料咧就係喺東華醫院嗰啲網站嗰度攞到，亦都可以上呢個華人社區健康資源中心嘅網站攞到嘅。
All right, thank you so much. I appreciate your time.
多謝晒 Thank you, Lindsay.
Thanks, Lindsay. So thanks to all the presenters this afternoon for very informative presentations. So the question in the chat is, BFAST seems more observational and physical. For a minor stroke, would BFAST still be visible? Well, the symptoms of a stroke are so different depending on the part of the brain that's involved. And so sometimes it's not so much you as the patient that you feel it, but it might be you recognize it in a family member or someone around you. So BFAST is not just to recognize symptoms in yourself, but also to recognize symptoms in others. The second part of the question is, would a bloated sensation in the head be an indication of high blood pressure? Certainly, some people with high blood pressure feel when the blood pressure is high, but many patients don't feel anything when their blood pressure is high, and that's why we call it the silent killer. You really need to check your blood pressure in order to really know what it is. But yes, sometimes when blood pressure is very high, you can develop symptoms.
咁呢個朋友咧就係問話 BFAST 啊 BEFAST， 即係呢個簡稱咧，呢啲即係話平衡有問題啊，眼睛睇嘢有問題啊，或者係手腳有問題，但係單邊有問題啊，或者講嘢有問題啊，或者笑嘅時候面側埋一邊啊，呢啲咁所有嘅症狀咧，就係我哋話呢個去斷診呢個中風嘅症狀咧。佢話係咪喺一啲細嘅中風嗰度都有呢啲症狀嘅？咁細嘅中風可能都有呢啲咁嘅症狀啦，當然係咪？咁咧，金醫生咧就係話，即係呢啲咁嘅症狀咧，就亦都唔係話淨係個病人話俾你聽，你亦都可以喺個病人嗰度，你有一個觀察者嘅角度啊，係可以睇到你身邊嘅朋友家人可能有呢啲咁嘅症狀，係睇到佢哋有中風嘅。OK， 咁咧就係好多時咧，呢個細嘅中風咧。就係個主要嘅原因咧，就係因為佢哋嘅中風咧係個症狀係可以係短暫啊 ，OK， 即係幾個鐘頭之後，或者幾分鐘或者10零分鐘之後係可能冇咗嘅。咁呢啲叫做細嘅中風，就並唔係個症狀係點樣咁唔同法嘅。咁咧佢話呢個高血壓，如果個頭好似脹，個頭好脹啊，覺得好有壓力，好脹咁，呢個係咪高血壓嘅症狀咧？咁其實高血壓咧。我哋叫佢做無形殺手嘅，因為高血壓好多時係冇症狀嘅，所以佢有症狀嘅咧，咁即係算好彩咯，係咪？但係咧，佢話有呢個咁嘅感覺，係咪高血壓咧？最簡單嘅方法就係去量下血壓啦。咁啊，希望大家係如果自己有高血壓嘅，喺屋企都有個血壓機啦。如果冇嘅話，就唔該你去買個啦 ，OK？ 咁所以係唔需要估嘅。你覺得係個頭脹喎，唔知係咪高血壓咧？咁去量下咪知咯，係咪咁簡單啊？所以咧。就可能係，亦都可能唔係咯，因為高血壓通常就係冇症狀嘅。
For post-stroke care, would you recommend assisted living versus memory care? What are the factors to consider?
I think it really depends on the patient and the circumstances and the severity and constellation of impairments after stroke. There are many patients who may need assisted living, but there are also many patients who may not. So as I referred to in my talk, I think really characterizing the impairments after stroke is important to help inform decisions like this. And there's often teams of individuals that can help patient or family make these determinations in coordination with the healthcare team. This may involve case managers or social workers and the therapists, along with the physicians that are administering assessments and care. So it really depends on the patient. Unfortunately, I can't give a specific answer here.
呢個問題，呢個朋友咧就係話中咗風嘅病人係咪需要去一啲其他嘅地方住啊？可以幫到佢個腦或者係幫到佢有啲人幫到佢嘅日常嘅生活啊咁Cathra Halabi 咧佢嘅答案咧就係其實大家都知道啦，答案佢點可以一言而論咧係咪？一定要睇個病人同埋佢自己嘅家庭嘅狀況同埋佢需要嘅咩嘢，個家庭可唔可以配合？因為配合唔到啦，咁你要揾人嚟幫咯。係到底係要去其他嘅地方住啊，抑或係揾人入嚟屋企幫咧？呢個即係要睇下你當時嘅環境住喺邊度，有冇人咁樣做，所以呢個係唔可以一概而論咯。對唔住嚇。
I did want to thank Diana especially for arranging this symposium, to our technical staff as well, Clifford Sachs, Raymond Wong, our panelists today, Vanja Douglas, Esther Chen, Lindsay, Carey, and Cathra Halabi. And I'm sorry, I left out Cindy Greenfield for the technical support as well. Really just a tremendous effort by everyone involved. And thank you again, Diana, for your leadership.
Oh, thank you, Dr. Kim. 好多謝 Dr. Kim， 我哋即係好多謝今日嘅講員啦，亦都係好多謝特別多謝我哋呢啲長期幫助我哋嘅員工啊，係Clifford 啊、Sandy 同埋Raymond 嘅 ，very thankful。咁亦都多謝大家嚟參加啦，冇咗你哋我點可以做講座咧？係咪？咁請你哋如果係有問題嘅，係同你哋嘅家庭醫生傾下，就自己大家留意自己嘅健康，希望唔會做中風嘅地方。如果有中風嘅時候咧，就唔好猶豫，記住打就記住嗰個黃金時間，得4個半鐘頭係由症狀開始去到醫院 ，OK 係可以開始呢個治療。咁喺中間係經過好多嘢要做嘅，所以千祈唔好等。So thank you so very much for everyone for joining us today.
Thank you so much.
Thank you, everyone. Bye.
Thank you. Bye-bye.